So welcome everyone. I appreciate everyone coming out for, what just said, this is hopefully the first of many of these type of trainings and informational sessions. I'm gonna jump right in, and the topic today is mental health in the time of COVID. I think this is for obvious reasons a very critical topic for our students and our families, and it's I think something that everyone should be paying close attention to. So as far as the agenda for today, we're going to be talking about just overall mental health and youth with special needs as a kind of an introduction. We're going to talk about the impact of COVID-19 as well as the current racial and social unrest and how that affects mental health, possible warning signs for mental health concerns, as well as tools and resources for you to use for your students as well as students, resources for you to use for your students as well as yourselves. And then, like Jess said, we'll have a question and answer session at the end. So please have your questions ready, and hopefully we can have a good discussion. All right, so many of you are likely aware, but just going over some common characteristics and experiences of youth with special needs. Some of these characteristics in and of itself can negatively impact mental health. And that includes difficulty with emotional regulation and utilizing coping skills, communication skills, difficulty with social skills, which can then lead to social isolation, and that's a big risk factor for depression and some other mental health concerns. Challenges with executive functioning, that problem solving, as well as academics, affecting academics, and possibly struggles in the school setting. There's generally, or I should say oftentimes, a sense of inferiority or differentness. Not all of the student, not all of children with autism may be aware that they're different. I put that in quotes. But a lot of times there is a sense that they are different, that their brains don't work the same as, say, a neurotypical child, and that can lead to mental health challenges. And there's also the fact that children with special needs are more likely to experience bullying and victimization, which can lead to mental health challenges. So mental health concerns, disorders, challenges, however you want to frame it, is very, very common with youth with special needs. For autism, about 70 to 72% of youth with autism have at least one co-occurring mental health condition. So that means not only are they diagnosed with autism, but they're also diagnosed with, say, an anxiety disorder or ADHD, or a mood disorder such as depression. And that's an incredibly high number. And 40% have at least two co-occurring conditions, 24% have at least three or more. So mental health disorders and difficulties there go hand in hand with autism. It's also prevalent in intellectual disabilities. 30 to 50% of youth with an intellectual disability also have at least a co-occurring mental health disorder. And then it's also common in learning disorders. So again, it's very, very common for youth with special needs, and something that's, I think, gaining increasing attention, particularly in the autism community. Mental health within autism is really, it's challenging to diagnose anyone, or we'll say youth with mental health, with a mental health condition, because of one reason is because of diagnostic overshadowing. And what that means is that a lot of the signs and symptoms in mental health disorders are also prevalent in what may be a typical presentation of autism. So it can be really challenging, especially because autism can kind of be used sometimes as a catch-all umbrella diagnosis. So we're not sure, this child's presenting this way, this child's presenting that way, we're not really sure what it is, so we'll just label it autism. So that can be helpful for some in some ways in terms of maybe accessing services, but it's challenging in terms of trying to determine what treatment to provide and how to address the symptoms that are being displayed. So you have issues like, is the social withdrawal or say social isolation, is that a result of say an anxiety disorder where they're fearful of say some sort of negative social evaluation? Or is that more along the lines of kind of, that's a typical say autism presentation where some people with autism are just not interested in interacting socially with people. So it's really challenging. The same thing can be said about inattentiveness when you're talking about when you're talking about, is that part of autism? Is that part of a separate? Is that part of ADHD? For OCD, is the repetitive behaviors, say lining things up in a row over and over and over again, things having to be a certain way. Is that obsessive compulsive disorder? Is that autism? Is it both? And trying to pick out what is really challenging. But it's just again, the takeaway here is just the prevalence of the mental health concerns with the special needs, in particular autism. All right, so you guys may have heard of the pandemic that's going around. It's a challenging time, and it's particularly a challenging time for, I think, for families with children in school, and especially children, families with children and adults with special needs and autism. COVID-19, obviously right now we're facing, we don't know what's going to happen tomorrow, next week, next month. Everything's kind of on a day-to-day basis. And that's really challenging for neurotypical. I know it's something I struggle with in terms of trying to figure out exactly what's going to happen. I want to know, when am I going back into the building? When am I going to be able to, get back to normal? And it's hard. It's even harder for those with autism who kind of function with needing that predictability, needing that certainty. The structure of the school day it's different at home with the online learning than being in the school building, and that's really challenging. There's the heightened sense of fear of health anxiety, fear of being coming down with COVID themselves, or maybe fear of the health of loved ones. Increasing isolation is a big one. Dealing with the quarantine, not being able to see people is really, 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 really challenging. Getting back to the online learning, it's a really, I've been coming as a new member of Ivymount's team, and coming from another school, and I've been absolutely blown away by the programming I have seen in the different programs, and the things that teachers and classes are things that have been put in place. But to be frank, it's not the same as being in the building. And now parents, as you are well aware, you're being asked to be part teacher, part social worker, part speech language pathologist, part OT. Oh, by the way, you also have to work and take care of your other kids and do all the other household stuff that you're responsible for. So that, it's hard. There's no way around it. And I think that's something to consider, and we'll talk more of ways to try and help manage those challenges. But again, that goes into the increased stress, and there's lack of services right now in terms of respite. You're not getting a break. That's going to affect caregivers. That's going to affect the child. And again, that's going to most likely lead to some mental health concerns. So on top of the pandemic, we've also had incredible social and racial unrest throughout the country. And I think a lot of our children, not all, but maybe, there's definitely some that pay very close attention to what's going on in the world. And they may understand all of it. There may be some limited understanding, but there is likely some sort of sense of hopelessness, unfairness, injustice, And again, when those that combined with what everything else is going on is really, really hard. So there's just a lot going on right now. So the bottom line, you have the special needs youth and mental health. It's a concern. It's an issue in any type of environment. You add COVID, you add the social unrest, and it's just kind of it's a recipe for mental health concerns. And whether that's depression or anxiety, whether it's new mental health conditions coming on or other ones becoming worse. It's the bottom line again is, we are in a time of the time of uncertainty is really, we're at a heightened risk for mental health issues. So now I'm going to go over some warning signs that you might want to look out for your child. And just because they're displaying one or more of these warning signs does not necessarily mean there's a mental health condition, but it's just something to look out for and try and pay close attention to. So there is appearing more tired than usual, appearing more irritable, and that's especially one to look at. Depression in children typically shows up as more of a, not always, but typically as irritability, and not necessarily as kind of the doom and gloom depression you might typically think of when you think of depression. So irritability is a big warning sign. Lack of hygiene, losing or gaining an obvious amount of weight, excessive sleeping, where they're sleeping all day, not participating in their typical activities, or not sleeping much at all. Both of those are signs. There's negative self-talk. I hate myself. I can't do this. I'm giving up. Other language you want to look at is your child displaying a sense of hopelessness. We're stuck in this situation and it's never going to get better. That and a sense of feeling like they're a burden, and that can be, that can depend on the awareness of your child. But a child with special needs sometimes know that they're maybe if they have challenging behaviors, that they know that is a stress and that can be difficult for their family to deal with. There's a lot of times where their behavior is displayed and then afterwards there's a lot of guilt and shame involved, and feeling that way in a typical environment, adding to COVID where there might be stresses on top of that with the family, financial concerns, everyone's on top of one another. So you're looking for that a sense of, again, hopelessness and burdensomeness. That language is a red flag right there. Any sort of withdrawal where they're typically not withdrawn, spending all their time away from people in their room, not being socially engaged. Again, that goes along with previously enjoyable activities no longer enjoyable. The sense of what's called anhedonia, where they're just things they used to like, they don't like anymore, and that can be a variety of different things. All right, next, still some more warning signs. There's a lot. Overabundance of caution with leaving the house, even for essential reasons. Obviously we all want to be careful when we're leaving the house, but if they're absolutely refusing to leave the house under any conditions, that's a red flag. A fixation on germs or an increasing fixation on germs consistently. When we're having a couple weeks off from school, they get a break from school. I'm sure most are happy about that. But when we come back, if they're consistently late or tardy to class, that's a sign, and not completing work or engaging in class. So in a nutshell, what you're really looking for is noticeable changes of behavior. I think, a lot of our students, your children, they might exhibit some of those warning signs that I mentioned. They might exhibit those on a day-to-day basis. So just because they're exhibiting those on a day-to-day basis does not necessarily mean they have a mental health condition. It's possible, and it might be assumed that it's just part of their autism, and it's not. But that's a little different than what I'm talking about now. What I'm talking about now is noticeable changes of behavior. You're seeing something different in your child that you didn't see before. And that's really what you're going to look for in terms of diet, hygiene, behavior, all of those. What's different? How are they acting differently? And that's that. If anything, the big takeaway from this presentation, or at least one of the big takeaways, is noticeable changes of behavior. So if you start to notice these warning signs, and there's definitely some strategies and tips that are helpful in these situations. The first one is keeping lines of communication open, and identify and then validate feelings and concerns. A lot of a child may not be very logical in what their concerns are. You don't have to necessarily agree with what they're saying, or maybe it's more of a sense of frustration and agitation. You don't necessarily have to agree, but it's really important to hear them out and validate their concerns. And so they know that they can be heard. And that's one, I think that can help alleviate some of their concern, but it's also going to lead to them being more willing to share their concerns with you. Obviously, as parents and caregivers, you don't want your child to suffer. And that's, of course, completely understandable. But sometimes I think that, there's a sense of trying to dismiss some of the concerns and saying, oh, don't worry about that. That's you're fine. Don't worry about it. You're not gonna, you're not gonna get sick. It's, that just don't worry about it. And because you don't want them to feel bad and you want their discomfort to go away. But that could, again, lead them to shutting down, and you want to kind of do the opposite in terms of validating their concerns, hearing their concerns. Then you want to follow up, checking for what they understand of the situation. What do they know? Is what they know, is what they're telling you, is it accurate? Does it make sense? And then you want to clear up any misperceptions. That might include, how contagious they may think COVID is, or what the chances of them becoming sick, or what the chances of someone, a young person, getting seriously sick. So you want to make sure that they understand the situation. You clear up misperceptions, and then without needing to constantly reassure, you want to review the COVID safety precautions. Like, yes, this is a dangerous situation, but that's why we're not being in school. That's why we're wearing masks. That's why we're social distancing. And again, you're going to have to, of course, tailor this talk to the level of your child. And for one child, it might look very different for another child. And some of this you might have to emphasize for one child that you don't have to emphasize for another child. So you got, as parents, your child best. But the important thing is keeping the lines of communication open, checking in. Don't assume they understand something that they may not. Don't make assumptions that they may appear okay, but might be worried about something. It might not be obvious that they're struggling with something related to mental health. So again, checking in and keeping lines of communication open is really important. And also a tip is talk to your student when they're feeling well. Their moods, more likely than not, is gonna fluctuate, and it can be challenging when they're feeling upset or after some challenging behavior, and it's hard. It might be hard to have a conversation then about how they're doing. Talk to them when they're feeling better. Ask them about their concerns, and you can ask them, when X, Y, or Z happens, what is helpful for you in terms of my response? What can I do to help? What things are helpful in this situation? And sometimes when they're in a better mood, they're more able to communicate their needs rather than waiting to in the moment when they're too heightened to communicate effectively. Encourage and facilitate social interaction. I know that there are, the programs at Ivymount have been, there's a lot of options, there. Engaging in physical exercise is really important. Have them go outside, take a walk. I know that can be a struggle for some students who refuse to do it, but getting outside, getting physical exercise is really important. And communicate your concerns. That includes with mental health providers. That includes at school. You know, we're going to be on break for 2 weeks, so in the next 2 weeks, the school mental health providers won't be available. But if you have outside providers, communicate your concerns. It's really important that everyone's on the same page. This is especially true now more than ever, because for your school mental health providers and the teachers, they're not seeing the student live. They're not seeing them in the flesh, so to speak. They are, you know, it's through a screen, and that's just, it's not the same. And again, as parents and caregivers, you're the expert on your child. You know your child best. You know when your child's acting typically, and you know when your child's not. And so, for instance, for me as a mental health provider, I'm not able to, I'm not able to check in as much with the student. I'm not able to see the student as much as I might be normally in the building. So hearing information from parents, hearing how they're doing, hearing what's going well, hearing what's not going well is really, really helpful for me. And it helps me in sessions address what any issues or concerns that are going on. And I think that goes the same for any outside mental health, any outside mental health providers. It's really important for everyone to be on the same page. The next one's a big one: limit consumption of news and social media. And this is hard in terms of, you want students to know what's going on. I think that's important, but you want to limit what they're accessing and how much they're spending, whether it's on social media or just watching on their tablet or whatever. That can be really, 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 really detrimental to mental health, cause a lot of depression, a lot of anxiety, or at least make it worse. So trying to limit that. I'm not, I understand that saying limit screen time in and of itself is easier said than done in a normal environment. And it's especially hard in the COVID environment, where you're trying to get work done, and the only thing that can keep your child occupied is the tablet or their phone or whatever it is. So I get that completely. It's hard, but trying to limit consumption of news. Some students, I've talked to recently get very, very preoccupied with that, and that can be kind of a dangerous combination. All right, a couple more tips. Develop and enforce structure, routine. That's really important. Our kids thrive on structure and routine. I think again, I understand it's challenging in this environment, but I think you can start by what time should they get up in the morning? What time do they go to bed? What time are they going to eat their meals? And with those things being relatively constant, and then you're kind of just filling in the gaps. So to me, that's a good way to try and just start off with some structure. And your child, if you have to use visuals, if you have to use some sort of whatever it is that you need for your child to understand, use those tools. But the structure and routine is really important. And that's something to consider for the next 2 weeks, especially with no school. School at least provides a little bit of structure, so something to think about. Provide choices when appropriate, and I think that's important. Again, for typically trying to manage challenging behaviors. But in terms of COVID, it's important because giving your child choices is going to give them a sense of agency, they have a sense of control, where that's really, really lacking right now for them. And they can't go anywhere. They can't go to school. They can't see their friends. They might not be able to visit family. They can't go to their favorite restaurant. So with those limitations in place, it's important to provide choices when they can. That could mean, when they do their chores, their schedule, when they have screen time. There's lots of different things. The choices, of course, are going to be up to you. They don't get free reign, but they at least have a choice, and that's going to give them a sense of control. Modify expectations. Think about the current environment we're in, and what is reasonable for your child to. How is it what is reasonable for your child to be doing in these circumstances? How is it reasonable for them to be behaving? And, it's not just lowering expectations, and we'll talk about that in a little bit, but it's just being realistic of the environment we're in and trying to maintain being realistic so it's not at the detriment of the child. A big one, explicitly model coping behaviors. So sometimes it's not what you say to your child. A lot of times they're going to take away from you, how you're acting, and they're going to, if you can actually model those coping behaviors. And sometimes it's going to take, I'm going to go take a walk right now because I'm feeling really stressed out. You might have to explicitly state that to your child. That thought process might not happen on its own, but modeling the coping behaviors, saying what's going on explicitly is really, really important. And they see you doing that, it's going to make it more likely they're going to do it. Also, showing vulnerability. This is, I think, in my experience, working with families with children with autism and special needs, there's oftentimes a sense that, I got to be perfect. I have to be strong. I have to be a tough one. I can't let anyone know I'm struggling or that this is difficult. And why I definitely understand that sentiment, I think it's okay to acknowledge that you're struggling with something. It's how you're modeling that things are not okay right now, and sometimes it's okay to not be okay. And when I'm not okay, what are the things I do to feel okay? What are the coping skills and strategies I use? So you're modeling that, showing vulnerability, and it also gives yourself a break because, and we're going to talk about one of my favorite topics is self-compassion and how that can be utilized to manage the stresses that we're experiencing now. But showing vulnerability, it gives you a break from having kind of that shield up, so to speak. And it's so I think that's really important. Also, where are we? Okay. Some overtly concerning behaviors, threatening to hurt self or others. We're talking about an escalation of behaviors, suicidal ideation, thinking about suicide or expressing willingness to die, indication of a plan, and self-injury. Those are huge red flags where immediate action is more likely needed. And that doesn't mean it's necessarily a crisis situation, but those are significant red flags where you're thinking about what needs to happen next. So if your child's experiencing the escalating behaviors, threatening to hurt themselves, any sort of suicidal behavior, any sort of self-injury, and again, maybe they're always displaying self-injurious behavior, but now it's more frequent or more intense. So I cannot emphasize enough to take the situation seriously, assess the situation. Okay, think about safety, and think about what steps need to take place to ensure safety. This and this the next steps, it could depend on the behavior. It's going to depend on the child, but that could involve informing the mental health provider, whether that's at school or the outside mental health provider. If a child doesn't have outside mental health services, maybe acquiring outside mental health services. And a big one is reducing the means. If your child talks about a plan of grabbing a knife and doing some sort of harm to themselves, then that means maybe locking up the knives so they don't have access to it. If there's any firearms in the house, that's locking them up or getting rid of the firearms in the house as your child's experiencing worsening mental health. So you really want to think about the safety of your home and reducing the possible means. Also, developing a safety plan. In the resources, we are going to be giving you a couple templates that you can use to do this. But a safety plan is basically a way for you and the child to document concerning behaviors. It's a way to kind of list their coping coping tools and strategies that they can utilize in the moment when they're starting to notice their triggers and what they can do when those triggers occur. It's having contact information of providers, and it's a plan for things they can do when they're starting to notice, or you're starting to notice, that their mental health is deteriorating a little bit. A crisis plan is a little different. If you notice, I recommend having some sort of crisis plan for your child. And what that entails is more of if our child displays this behavior, we're going to do X, Y, and Z. So for example, if there's any siblings, we're going to take the siblings to grandma's house, and mom's going to take, or dad's going to take the child to the hospital. Or whatever the case may be, you're developing a plan in advance, so you know what's gonna happen. You're not gonna be caught off guard, and it can also include a list of medical information that can just make it easier if you have to go to the hospital, of diagnosis, medical information, past hospitalizations. Having that information handy is important. And then contacting crisis support services. We have some numbers here, and those will be in the resources. They may not. I would not call them if there's immediate danger. Call 911. Let them know about the student's diagnosis. But if you kind of sense the behavior is escalating and you can kind of see where it's going, crisis support can be helpful. All right, self-care. Self-care has been a buzzword. It's come up a lot lately, and I think it's actually maybe even starting to get a negative connotation, as in like, oh, I need to go to the spa and take care of myself. That's self-care. And I'm trying to, I advise parents of any caregiver, especially one of children with special needs, is to shift it. It's the stresses, like we said earlier, the stresses of raising a child or adolescent with autism are magnified, and it can be intense. So self-care can be less about yourself, really, and more about how you're able to provide care for your child. And to be able to care for your child, you do have to care for yourself. So shifting that from self-care as something selfish that you can only do on a limited basis, but as it's caregiving, sustaining acts. And I really believe that, and it's not optional, but essential. And it's not just for yourself, it's really for your child and your family. All right, another way for self-care is just reframing our thoughts. It's easy to get very negative in terms of virtual learning being miserable, there's not learning going on, decreasing expectations, social distancing. Those are just a few examples of ways that you can kind of reframe things, and that can affect your mood in terms of just how we're processing things. All right, so some examples of some caregiver sustaining acts. Practice what you preach. A lot of what I talked about earlier in terms of helping your child is also going to help yourself. For you to engage in social interaction, for you to limit your consumption of the news, for you to have structure and routine, for you to modify your expectations, and at times access your own mental health support. Ask for help. All right. Families of children with autism are already typically isolated. Your experience is not of the typical child, and maybe not of the typical family sometimes. And it's critical that we reach out and ask for help, whether it's with family and neighbors. And yes, that's might be limited now because of COVID, but emotional help, emotional support, emotional help, that's still available. But sometimes people aren't going to know unless you ask for that help. Then practice self-compassion. How we treat ourselves is incredibly important to our mental health and incredibly important to our self-care. And I'm going to expand on that in a little bit, but also expressions of gratitude. A lot of times we get stuck on thinking of what we don't have and the way things aren't the way they're supposed to be or the way we want them. But can you think of things that you do have that you can be grateful for? So, for example, keeping a gratitude journal would be is advisable. All right, I got a couple minutes left. I want to get into just self-compassion real quick, and then I'll get to some of your questions. But real quick, self-compassion is how we treat ourselves. A lot of this, one of the most prominent researchers of self-compassion is Kristen Neff, and that's her website there. And she identifies really three main parts of it: self-kindness versus self-judgment is the first one, and it's how we treat ourselves. We can be so incredibly harsh on ourselves. I think that's especially true of parents of children with special needs, that, oh, I didn't do enough for my child in this situation, or they see that maybe the child's not progressing the way they would like, and they see that as a reflection of themselves. But the things we say to ourselves is oftentimes a lot. It's incredibly harsh, and it's oftentimes a lot more harsh than what we would say to a friend or a loved one. So consider what you say to yourself after a certain situation. Is it the same? Is it what you would say to a loved one? And kind of put it in those terms and think about how you're treating yourself. And then realize that what you're going through it's a common experience. People are suffering right now, and I think the autism community is facing significant challenges right now. And why it may feel isolating and you may feel you're alone, realize that it's not just hard for you. You're not the only one struggling, and that other people are many people are going through the exact same thing that you're going through. And then the last piece on that is just, it's being mindful. That's another buzzword that I think, it can mean different things to different people, but in short, it's it can be very overwhelming to think, how am I going to do this for another 6 months? I'm going to be miserable for the next 6 months, or the last 6 months have been miserable. How am I going to do this for another month, another 2 months, etc.? But you can get through the moment, you can get through the hour, you can get through the day, and you're trying to just shift your mind to what's going on in the present, to keep from being overwhelmed.